in your life.
Good afternoon on this beautiful Sunday afternoon that the Lord has made. The Aiken chapter of the Links Incorporated and Aiken Alumnae chapter of Delta Sigma Theta Sorority Incorporated extends a heartfelt thank you for joining us this afternoon as we go red for Healthy Heart Month. According to the American Heart Association, its signature women's initiative, Go Red for Women, is a platform designed to increase women's heart health awareness. It's no longer just about wearing red or sharing heart health facts. It's about all the women making a commitment to stand together and take charge of their own heart health, as well as the health of those they can't bear to live without. This webinar includes presentations from a heart transplant recipient, persons living with heart disease, a family practitioner, and a mental health professional. In addition, this webinar will bring awareness to organ donation and its need in the African American community. Today's webinar is in memory of Mrs. Belvier B. Payne, former member of the Aiken chapter of the Links Incorporated, who suddenly died of a heart attack in 2015. Every year, as the nation brings awareness to heart disease, the Payne family remembers the anniversary of her death, February the 9th. Mr. Justin Payne, the son of Belvia Payne, has shared how he was called to the office at school where he learned of his mother's death. His first instinct was to call his mother to see what was going on. He also credits his father, Terrence Payne, for helping him cope with the loss. This afternoon, you will hear from the presenters the importance of a strong support system. Sit back, relax, and join as we continue our journey in maintaining a healthy heart. Today's first presenter will be on organ donation by Ms. Keisha Mays, the connection between chronic diseases, the connection between chronic diseases and a need for organ donation in the African American community. Ms. Keisha Mays.
Good afternoon. My name is Keisha Mays, and I am an education specialist with LifeLink of Georgia, where we heal and save lives through organ donation. So basically, we cover the whole state of Georgia, but also we cover Aiken County and Edgefield County as well. So I just wanted to start with some basic general statistics on organ donation. So in the United States, there are over 110 people waiting for life-saving transplants. So once again, in the US, 110 people are waiting for life-saving transplants. But let's break it down to what's going on in our area. In Georgia, there are currently 4,700 individuals that are waiting for those same organs. In South Carolina, there are 1,200 individuals. But let's break it down a little bit further. I'm like, okay, that really doesn't apply to me. On that list, the majority of those people, more than 60%, are African Americans that are waiting for organs. And if we look at what organ we're waiting for, mostly it's going to be kidneys. Why is that? African Americans suffer at a higher rate of end-stage renal failure than any other race, 4 times that of Caucasians. So that's due to high blood pressure, diabetes, how we're eating, how we're living, and how we're not really being physically active. All those things play a factor in our high numbers of high blood pressure and diabetes, if we look at that. And if we want to add high cholesterol as well, that puts us at risk for a higher rate of cardiac death. All those factors play into the need for us to receive organs. Look at Aiken County. My little cousin, she was 14. She received a liver transplant on 12/12/19. There's a young man, 7 years old, in Edgefield County that is currently waiting 7 years old for a heart transplant. So this is impacting our community more than we really talk about. But let's talk about some other things that I've heard a lot of times when I'm out there in the field regarding why I'm not going to be a donor. Medical professionals, they're going to do everything they can to save your life. Medical professionals. My husband is a police officer, first responder, so he's not going to look at your license and say, oh, well, you're a donor, so I'm not going to help you out. No, they don't do that. Their thing is to make sure they get you to the hospital, and they're going to do everything that they can to save your life. The doctors, once you get there, regardless of your age or your medical condition, think about becoming a donor. Don't rule yourself out. When the time comes, let the medical professionals do the exam. You may not be able to donate your pancreas due to diabetes, but you may be able to donate your heart. You may be able to donate bones, skin, tissue, things of that nature. So do not ever rule yourself out about possibly becoming a donor. And all major religions actually supports donation. A lot of times people, oh, my pastor don't believe in it. Most major religions, they actually believe in donation because you're giving somebody an opportunity at life again. You still can have an open casket funeral. If you decide to be a donor, your body is going to look the same. And then the cost of donation is covered by the donation program. So regardless of if you never thought about it, just start thinking about it, because the more African Americans that become donors, the more of us that can get off that list. And with matching, more than likely, you're going to match better with somebody who look like you. If I'm African American and I need a kidney, my best match for a kidney is going to be another African American. So just think about becoming an organ and or tissue donor. And that's why we're here. If you have any questions, feel free to contact me. I'm always going to be around. And I am also a member of Aiken Alumnae chapter of Delta Sigma Theta. So if you need to reach out there, I'll be there as well. So thank you. I'll turn it back over.
Thank you, Sarah Mays. We appreciate all that wealth of information. Next on the agenda is Sarah Dr. Catherine H. Toomer, Family Medicine, Aiken, South Carolina. She's going to talk on diagnosis, symptoms related to heart disease. Sarah Toomer.
Hello. Again, I am Dr. Catherine Toomer. I am a community health and family medicine physician and a member of Delta Sigma Theta Alumnae chapter. And I'm going to talk a little bit about heart disease, some of the signs and symptoms of different types, so that it can be recognized, hopefully prevented, and taken care of if diagnosed. And so first, it's really important to understand the different types of heart disease. There are blood vessel disease, which is coronary artery disease, which leads to heart attacks, heart arrhythmia problems. There are also, which essentially is your heart beating too fast or too slow. There's heart defects. Those are usually found early because they're congenital. They're usually found at birth or shortly after. And then there's heart valve disease. And I'll talk a little bit more about each of these as we go along, but the disease also of the heart muscle, and then there's heart infection. So these are all things that that can happen to your heart, and these are all things that have different symptoms. Some of them are the same, and I'll talk about that also very briefly. So the symptoms depend on the type of disease that's present. The most common cause of heart disease is coronary artery disease, and if not addressed, it leads to heart attack and strokes. Hypertension, which is high blood pressure, is another that's very common, especially within our community. And it results in arterial disease throughout the body, including the heart. It's also called the silent killer because symptoms are often not felt until it's too late. The most common signs of coronary artery disease are the ones we often hear about: chest pain, chest tightness, chest pressure, chest discomfort. Those are all referred to as angina. There may be shortness of breath, pain and numbness or weakness of your legs and arms are another sign. What happens during coronary artery disease or any type of blood vessel disease is that your blood vessels narrow. So everywhere that blood goes can have symptoms if there's problems with the arteries. You can also get pain in the neck, jaw, and the throat. in the abdomen or the back. That's less common, but it does happen. Chronic cough is another symptom that is not as common, but again, it happens. And being really tired is another. So anytime you're having any of those symptoms, it's really important, especially if they come on suddenly, to talk to your doctor about them. The heart disease caused by arrhythmia, which is your heart beating too fast or too slow. Both of those things can cause problems. Both of those things can lead to serious side effects. But essentially, the symptoms for that are fluttering in your chest, racing of the heartbeat, slow heartbeat, which is bradycardia, chest pain or discomfort. Again, if your heart's beating too slow, you can't get blood to your heart. And so it gives the same symptoms as if having a heart attack and can actually cause a heart attack. Shortness of breath, lightheadedness, dizziness, fainting or near fainting. Again, if you're having those symptoms, talk to your doctor right away. And then heart disease caused by heart muscle, which is cardiomyopathy. That's usually what we call heart failure. And so you have different types, but again, those are breathlessness. If you get really tired on the slightest activity, if that's new, again, talk to your doctor. You can have swelling of your legs and ankles and feet, tiredness, irregular heartbeat, dizziness, lightheadedness. And of course, if you're listening, you can tell a lot of the symptoms for heart disease, no matter what type, are very similar to one another. And so again, if you have any of those, now the one that's a little bit different is infection of the heart. That's called endocarditis. And when you have that, you notice fever, shortness of breath, again, weakness and fatigue, swelling of your legs. You also might get swelling around your middle, like in your stomach, changing in your heart rhythm. Again, a lot of these are all the same symptoms, but again, if they come on suddenly, they could all be your heart. And so heart has 4 valves, and those are the valvular disease. And again, a lot of the symptoms are exactly the same. So it's really important to seek emergency medical attention. If you have any of these symptoms, call 911 or go to your emergency room. And again, it's easier to treat disease early than it is to treat after something's already happened. So talk to your doctor about concerns regarding your heart health. If you're concerned about developing heart disease, talk to your doctor about steps you can take to reduce your heart disease risk. But it's also important that if your family history is one where you have a lot of heart disease, if you have high cholesterol, if you have hypertension, if you have diabetes, if you're over 50, you should be checked for heart disease. And so it's really important then at any age to know what your blood pressure numbers are, what your cholesterol numbers are, what your diabetes risks are, which is your hemoglobin A1C, it's a blood test, what your complete blood count is, because anemia, when you have low blood count, is what your body does to spread blood around and oxygen around your body. Your heart is part of that system. So if you're anemic, your heart's overworking. So it doesn't matter how old you are, that needs to be corrected. Otherwise, like any muscle that gets overworked, if you work it too much, it starts to fail. And you don't have to have heart disease for that to happen. The other is if you're having irregular heart rate, the other is to get your thyroid checked, because that also can cause your heart to race. Heart racing over time can make your heart fail also. So again, make sure prevention is important. Know your numbers, seek your doctors if you have any of those symptoms, and follow through and follow up and stay healthy. So again, I'm Dr. Toomer. I'm a family medicine community health physician and member of Delta Sigma Theta Alumnae chapter.
Thank you, Sarah Toomer. Again, a wealth of information. We appreciate you taking the time to speak with us today. Our next presentation, Mr. Damon Woodruff was supposed to be speaking, but unfortunately his father passed and was just funeralized this past Thursday. So Ms. Virginia Rigsby is going to do his presentation, and it's on testimony as a heart transplant recipient. So at this time, Ms. Virginia Rigsby will speak.
Good afternoon. On behalf of the Health and Human Services Committee, where I'm the co-chair, as well as Mary Harton is my co-chair, Dolores Stewart, Bertel Simmons, Stephanie Alford, Felicia Williams, San K. Raleigh, Courtney Pope, Vina Arms, and of course, with the assistance of our president, Rosemary English, and Teresa Pope. As was stated earlier, Mr. Woodruff's father was funeralized on Thursday. And so he's unable to be with us. He was very excited about being here because he's very passionate about this subject. Imagine, if you will, August 2015, a young husband, father, son, and brother was told that his heart had weakened to the point that a heart transplant was needed for his survival. Here is a recount of Damon Woodruff's story in his own words, beginning with being told he was in need of a heart transplant. During his experience, he kept a detailed journal as well as a scrapbook. August 2015. First, my family would like to thank everyone for their prayers and support. We're blessed to have family, friends, and others supporting us through this experience. Vanderbilt officially placed me on the heart transplant list August 13, 2015. I am scheduled to have my last test on September 1st. This test will allow doctors to see how rapidly my heart is failing, which will tell us how soon the device used to help my heart procedure needs to be done. September 2015. My appointment on September 1st went well. The doctors placed me on a new experimental drug. The goal of this drug was to slow the process of my heart failure down. Unfortunately, my body was not responding well to this new medication, and my symptoms have gotten worse. Initially, doctors wanted to monitor me monthly, but they have moved my next appointment up to next week due to my condition. Will have a right heart cath and other tests on Wednesday. Fast forward, November, a few months later. The past couple of months have been very difficult physically and mentally for my family and I. I have taken countless tests along with medication changes in hopes of slowing down my heart failure. We met with doctors this past Thursday to discuss the next steps. Based on my continued increased symptoms and failing test scores, doctors advised us all medication options have been exhausted. The next step is for me to have the LVAD surgery, which helps the heart do its job. They stated without this surgery, my chances of surviving another year are not good due to my heart's inability to function. The device will act as my heart until I can get a transplant. The surgery will take 4 to 6 hours. Afterwards, I will be in the hospital for at least 2 weeks. And then we have to stay another 4 to 6 weeks in Nashville for rehab and follow-up appointments. Damon did a lot of research, and he found that by talking with other patients, reviewing studies and material, that this device should make him feel better than his current condition. Here's one of his inspiration stories that happened during his journey. He was looking for a piece of paper and found his 7-year-old daughter Santa letter. This was in November. He said, when I read it, I could not help but break down in tears. This took away all the pain and worries I have been feeling. I'm very blessed and lucky to have an awesome wife, 2 sons, and 2 daughters. Here's what it says. Dear Santa, some people don't believe in you, but I have ever since I remember. I'm not telling you what I want for Christmas. I want something you don't see every day. You see, my dad is very ill and has to go really far away for a very long time. And if you can, I'm asking you to heal him on Christmas Day. Please don't let me down, Santa. You are my hero. P.S. If you cannot heal him, it's okay. She then wrote down his name and their address for Santa. December 2015. The device was successfully inserted on December 2nd, 2015. I was released to go home on January 5th, 2016 to await a heart. Fast forward to May of 2016. I've been in and out of the hospital for the past few months trying to get the right setting and combination of medications to work together to get the full benefit from the device. I've been told that I am competing with 6 other people who fit the same criteria as me. Decisions are made on who gets a heart based on the current status of their heart and the best fit. On March 5th, 2019, God blessed me with a heart transplant after 3 years and 7 months on the waiting list. On April 4th, 2019, I was discharged from the hospital and sent to rehab for extensive physical therapy. I will return home after rehab and will continue to take anti-rejection medicine for the rest of my life. Today, Damon Woodruff lives in Knoxville, Tennessee with his wife, Jacqueline, and their 4 children as a heart transplant survivor. Throughout his experience, he remains grateful to God, his family, and others that make up his amazing support system. Last but not least, he is grateful to his donor for giving him a second chance of life. It is bittersweet because while one family rejoices, another family mourns the loss of life. That is, in brief, Damon Woodruff's a heart transplant survivor story. And that concludes the presentation. Thank you.
Thank you, Ms. Rigsby, for filling in for Mr. Woodruff. And that's a very great testimonial. And it really makes you think about becoming a donor. So next on the program, we're going to have Sarah Latrice Carter. She's living with heart disease during a pandemic. Sarah Latrice Carter.
Good afternoon, everyone.
Yeah.
Like Sarah Tanya mentioned, my name is Latrice Carter, and I am a heart survivor and also a former member of the Aiken Alumnae chapter of Delta Sigma Theta Sorority Incorporated, and now a member of the Petersburg Alumnae chapter in Virginia since leaving the CSRA. I have been living with heart disease since the age of 18. So for the last 20 years of my life, this has been a learning experience for me. From 4 stents, one in 2013, 2 in 2015, and 1 in 2017. Those were just Band-Aids to my severe heart issue, and most recently, living the aftermath of a triple bypass in 2018 has been life-changing for me and those around me. I tell everyone, especially young women, to take their health seriously. And I didn't have severe health factors prior to my heart conditions, which many people assume or think, with heart disease, they think, oh, it may have been, she's been overweight, she's this and that. I didn't have severe issues, but my health complications came from genetics, with having both parents with heart disease and several people in my family with heart disease. So I tell people to know your family's health history, because at times I'm even constantly asking, I'm finding out things like right now having thyroid issues and having to go back and ask, like, did someone in our family have that? Because I didn't know. So I always tell people to talk to their children about their family health history. So since COVID, my family and I have had to take drastic measures since we found out not only that we're adding a new addition to our family recently, but some things that we had to do. I am constantly going to monthly doctor's appointments every month. I have biweekly appointments, so not just one, but two, where they're constantly checking my heart. After my incident in 2018, I had to go through cardiac rehab for 6 months, but now I'm currently going back just so they can check and going to cardiac rehab to make sure my heart is strong. I've been getting COVID testing done, both my husband and I, because he's an essential worker and being high risk, we have to make sure we both are safe. So getting COVID tests done almost every other month as well. I've had the pleasure of working remotely as a national education advisor because I am normally on a plane 3 to 4 days a week, traveling to state to state. So it's been a benefit that I've been able to work from home, but I'm having to take drastic measures when I am leaving outside of the home, such as wearing the proper mask, making sure I have an N95 mask on versus a cloth mask. And sometimes I even triple layer with a cloth mask over my N95, wearing a shield, all these different things to make sure I have proper precautions when it comes to my health conditions. And I think the main thing living since COVID and living with heart disease is congregating with family and friends. Everyone knows that I love being around my family and friends, and this has been an emotional roller coaster for me, not being able to come to the CSRA at least once a month. They always know I'm there, but having to be mindful of the audience that I'm around, the amount of people that I'm around, and when I am around a large audience, just making sure I'm being very cautious. I'm family oriented. I make it my mission to see my mom, nieces, and nephews every month. But since COVID, we've been extra careful around crowds and have been taking certain measures. So I've learned to wear my scar with pride on my chest because a lot of times there's things that you have to reflect. It's an emotional experience when you go through heart health conditions. You don't look at yourself the same, but you have to. You have to wear your scar with pride. I'm very active now in my heart health by checking my blood pressure every day, and also making sure I eat healthy and maintain an active lifestyle. So all of these things I say to not only women, but also everyone, please take heart health very seriously.
Thank you. Very interesting, very informative. Thank you. Next on the list is Sarah Kadena Simpkins, living with heart disease during a pandemic. Sarah Kadena Simpkins.
Good afternoon, everyone. As Sarah Williams mentioned, I'm Kadena Simpkins. I'm with the Aiken Alumnae chapter, and I have been living with heart disease since October 24th of 2012. I actually had a massive heart attack on that day, and believe it was a life-changing situation. It was something that, people talk about the heaviness on the chest or tingling of that nature, and I had none of that. My husband and I were at my son's middle school football game, and I remember something coming over me, and before I could tell him something was the matter, I was down. And I was down for a while, and I did not realize it was a heart attack until my fingers started tingling and my jaws began to hurt. And that was when I knew that I was in the middle of a heart attack. And at that time, I was a first responder at work. So the first thing they teach you in CPR and AED training is you do not use an AED on a live person. And when they started breaking out the AED and prepping me for everything, I knew that I was not in a good situation. I left the football field and they took me to Edgefield County Hospital, and Dr. Massey and her ER group, she took the best care of me. She got me stable. She knew the situation. And when I finally came to the second time from just totally blanking out, she had the medevac there for me, and I was airlifted from Edgefield Hospital to University Heart and Vascular Center. From there, they did a heart cath, and it showed that my vessel had a kink in it. My cardiologist, Dr. Suling, referred to it as a hose pipe getting a kink, where as the blood continued to rush, when it met that kink, it just shut the heart down. And I have zero function of the lower apex of my heart. So after going through, I think, 3 months of extensive cardiac rehab to get me back the portion of my heart functioning at a decent level, I take medication every day. And, you know, raising kids, being a wife, a mother, it's stressful within itself, not necessarily bad stress, but just stressful. So, you know, it's a balancing act between the medication, between the kids, and my husband and my mom are my two biggest supporters with trying to keep my stress level down and just trying to make sure that I'm doing what I'm supposed to do. And, you know, it's dealing with the pandemic is hard because at first I was still having to go to work, but thankfully now I'm teleworking because I am an at-risk employee. So I've been working from home now for almost a month, but just being out in public, you have to be so careful because, you know, bringing it back into the house or someone in the house bringing it in. So I have to be careful with my kids. My husband is extra careful. And right now, that's just a way of life, but it's something that I have to do in order to maintain my day-to-day living. But I take medication. I see my cardiologist still every 3 months just because of my age. I'll be 49 in June, but after 8 years of dealing with this, he still wants to make sure that everything, my numbers are right, because a couple years ago, I guess I would call it somewhat of a setback. I was having trouble just making it from the bedroom to the kitchen. Walking the dog, I was so winded and could hardly breathe. I went to him and he did a heart cath. And now they do it in your wrist. They don't have to go into your leg anymore unless it's more invasive work they have to do. But before he did that procedure, my blood pressure was through the roof. I was just a walking time bomb and didn't know it. So once again, it puts me at a higher risk because my situation, I did not have to have any stents, no surgery, but there's no guarantee that it won't happen again. And my medication is so that should it happen again, I have time to get the proper care. But I've been managing it for almost 9 years now. And like I said, it's just, I know it's by the grace of God that I'm here. And I remember on my knees in the middle of the heart attack, when I realized that's what it was, and all of my focus was off of myself. And I started praying and asking God to take care of my 3 kids, because at that time they were 12, 6, and 4. So I just prayed and prayed that he would take care of them. And, you know, I don't know what all he has for me to do in my life, but I do feel that raising my kids and being the best wife and mother that I can be to the best of my ability is the mission that he has me on. So, you know, I've got one son that's 21 and in college, and I've got a 14 and a 12-year-old. So y'all pray for me with that 14-year-old. But, you know, we're making it. And I just, I'm thankful to be here. And I'm just thankful for my LS, Latrice, who is my back. You know, she went through even more extensive heart care than I went through. So I'm just, we have to band together and be each other's keeper. Thank you very much.
Thank you. Thank you, Sarah Simpkins. Very interesting stories, but one thing is for sure, we need to know our numbers, we need to take our medication, and we need to pay attention to the signs. And if it's something that's not normal with our bodies, we need to make sure we get in contact with medical. At this time, our next presenter will be Ms. Sarah Sherelle Butler. She's with Complete Care Counseling Group, and she's going to be covering areas of COVID and cardiovascular. So at this time, Sarah Sherelle Butler.
Good afternoon. To the Aiken links, I would like to thank you for affording me the opportunity to participate in today's event. And to the Aiken Alumnae chapter of Delta Sigma Theta Sorority Incorporated, my Saras, I am so grateful that we'll continue to collaborate, partner, and work with each other in our community to increase the awareness of cardiovascular disease. I was asked to speak today about cardiovascular disease, COVID-19, and depression. So the topic for today is CCD. I would like to share just a little bit about myself. My background is I am a licensed independent counselor in South Carolina, in Aiken, South Carolina, at Complete Care Counseling, which means basically I provide individual counseling, family counseling, group counseling, and marital therapy to people that are experiencing mental health challenges and behavioral health issues. So I come today because I was asked to speak a while back for another organization. And then I was preparing to speak for the organization, and I happened to hear on the radio when I was getting ready that morning for work, they had an interview with our former First Lady, Michelle Obama. And when we see Michelle Obama, we see a beautiful, intelligent African-American woman. And when I listened to her speak, she shared, I feel as if I'm down. I might feel as if there's a chance I might have a little bit of depression. And she said that. And she said it because of the two pandemics that we're experiencing right now in our society. And number one, it was the racial division in our society. That's what she was referring to. The next one was a pandemic, COVID-19. And I wanted to use her picture, this beautiful picture of a beautiful lady, and let us look at, a lot of times we think that we do not suffer depression or we cannot experience depression because we were taught and we know that we are strong. We are strong, Black, beautiful Black women. And so a lot of times we experience things in life, but we keep moving forward. We keep moving. But I want us to talk about, we can experience COVID-19, we can experience depression, and we can experience cardiovascular disease. And so we're going to move forward and look at depression. So basically, what is depression? It is basically a mood disorder that causes distressing symptoms which affect how an individual feel, think, and handle daily activities. And so when we look at what is depression, I'm going to eventually tie this in with COVID and tie it into cardiovascular disease. Next slide, please. So what is actually the cause of depression? Well, the cause of depression, can we go back to that slide, please? Okay, I'm sorry. Apparently I did not see the other slide, and I'll just go ahead and talk about it. The next slide deals with the causes of depression, which is COVID-19. So people are experiencing depression now because of COVID-19. And so COVID-19, there's many forms of depression. There's environmental depression, and that is what we're dealing with right now. The pandemic, which is COVID-19, which is actually situational depression. So there's different types of depression, which could be related to bipolar, which could be related to mild or moderate. And I won't discuss all the types of depression, but we're dealing with situational depression that is caused, the situation that we're in, based on COVID-19. And so when we look at that, this deals within the environment. So I want to break it down eventually into psychological factors, because what we do know, the depression will increase based on our psychological factors. And those psychological factors are also related to stress and social factors. But when we talk about the serious illness that we experience, and I'm going to briefly discuss that in the next slide, but the serious illness that we experience from the heart disease, cardiovascular disease, I want us to think about our family members, think about our loved ones, think about our seniors, our elderly patients, our grandparents, our great-grandparents, our mother, our father. Think about when they have a serious illness such as heart disease or cardiovascular disease. We have to look at sometime if they have had a heart attack, heart failure, or stroke, that it is not uncommon for a person to experience depression. Why do they experience depression? Because their body has changed. Maybe they have a disability now. Maybe they have to use a walker, use a cane. I can relate. My mother is one of these people. She had a stroke 5 years ago. And when she had her stroke, her life changed. This is a serious illness. And what happened was it was caused because of hypertension and diabetes. And what happened was she struggled with her independence because she had to move in with us for 9 months. I took care of my mother. She was dealing with the speech therapist, the occupational therapist, the physical therapist, but we're talking about a lifestyle change. When we experience a lifestyle change, sometimes we get down, sometimes we get depressed, and our family members, especially our elderly parents, they don't want you to know that they're sad. They don't want you to know that they're experiencing depression, and they don't even sometimes recognize that they are experiencing depression. All they know is that their life is not the same, and they do not want to be dependent on you. And so it goes on to talk about, we look at COVID is associated with mental health challenges related to morbidity and mortality. Now, my concern and our concern as African Americans, we are dying in the United States at a disproportionate rate from COVID, and we are dying at a 2.8 times higher rate than any other ethnic group, especially the white population. And we've also been perceived, and we have thought that many times African Americans did not really have a lot of issues with depression. That started to change in 2008 to 2017. The rates increased in the area of anxiety. Well, in 2020, what has happened since COVID, we have seen an increase in depression and anxiety in the African American community. And I want to talk about, when we tie all this together, we can go back to the cardiovascular one. Thank you. The cardiovascular, let's go back to that. This is all intertwined together. Heart disease is the leading cause of death in our society and in women. I actually focus on this in group settings. When I focus on teaching this in a group class or a group setting, I talk to people and I ask them, how many people in this room out of a group have had a loved one, or you may be experiencing cardiovascular disease? A lot of people are not sure that we're talking about not just a heart attack, not just a stroke, not just high cholesterol, but I want us to come back to and hold on to that red highlighted area, diabetes and hypertension. The other concern, when we have COVID, if you get COVID, there's a great chance that you can experience cardiovascular damage, and it can lead to heart failure. And that is based on the inflammation of the heart and the heart muscle, and it works harder to function with the heart and the lungs. What about stress? Stress occurs among individuals with heart disease at higher rates. So when we talk about stress negatively impacts our health. But then the outcome can also be a negative impact. And that's what we're dealing with, the psychological stressors. Psychological stressors over time will affect our body and can lead to our biological deterioration with our body, which causes an increase or can contribute to an increase of cardiovascular disease. So when we talk about diabetes and hypertension, these are the two major risk factors for COVID-19 than any other racial ethnic group. Next slide, please. So when we have intertwined all these together, we look at the psychological impact. There's a psychological impact that we experience. That would be the next slide. The psychological impact that we do experience. And I'm going to talk about the psychological impact because it will cause people to have depression or increase the risk for depression. I'm going to use myself as an example. A month ago, I'm exactly a month away from being out of quarantine. I was diagnosed with COVID. Now, I did not experience the fear of I was not fearful, but I want us to be considerate of people that have COVID and people that are around people, because my greatest concern at that time was my 82-year-old mother. My greatest concern was, had I exposed my mother to COVID with her underlying health conditions of hypertension, diabetes, and having a stroke. That was one of my greatest concerns at that time. The next concern was, I'm in practice. And so the concern was, did I expose any of my interns, any of my patients, or my providers to COVID? So those are real concerns that I was dealing with. Now, I want to tell you, I'm gonna be transparent. I was angry. I was furious. I was livid that I had COVID. And the reason why I was so upset about it, because my husband, I got it from my husband. And my husband is always so careful, always being mindful of being around a group or being around a certain part, being around people, period. Always making sure he was sanitizing his hands, washing his hands. He cannot figure out to this day how he got COVID. I know how I got it. I got it from him. So I was angry. But I want to talk about the issues that we deal with as Black women, African-American women, because as a director of an agency, I was dealing with that point, the financial concerns, because at that point, I am one of the top providers in our practice. I was diagnosed with COVID. That meant 2 weeks of unemployment. But what about my sisters that are single parents? Because we have a large population of Black women, African-American women that are single raising their children, close to over 70%. So if you look at the concerns that you're dealing with at that point, finances, am I going to lose my job? Am I going to get unemployed? How am I going to pay my mortgage? How am I going to pay my rent? But let's look at this. Let's look at the percent. Let's look at what happened to our women, because what happens, we are the first ones laid off because most of us are essential employees. First ones laid off, first ones less hours to work. But what about if you're a mom and then you're concerned about your children? What's going to happen with school? How am I going to manage virtual schooling? How am I going to manage school, period? And if you're a caretaker, remember, my concern dealt with other people. I was concerned about my mother. I'm also one of her caretakers. I was also concerned about my husband who had COVID. But I have to break it down a little bit further. I didn't tell you my whole story. I listened to my sorors tell their story. I've had cardiovascular disease for 32 years. And so I already had an underlying health condition. I have hypertension. When I went to the doctors, my blood pressure was over 200. I couldn't even think about my blood pressure then. When I left, it was 180 over 108. The doctor was more concerned about my blood pressure. I was more concerned about, what about my breathing? I have asthma now. So I was concerned about the breathing. But also what I was dealing with COVID, during that time, I was in a period of helplessness. And what I mean by helplessness, people around me, my loved ones had COVID, my friends had COVID, and I cannot mention names because you probably know these people. And I did share that I might tell their story, but I wouldn't mention their name. My best friend lost her husband. The whole family was exposed to COVID. Here I am at home. I couldn't help anybody. People were helping me. So you feel, experience, and you deal with a helplessness. Not only the helplessness, then you deal with grief. I'm dealing with grief. My best friend lost her loved one, okay? Her partner. Not only am I dealing with in my own life, there was 4 deaths that week from my church when I was dealing with COVID myself. My pastor contacts me. I'm over the ministry. Can you please contact these members? No, I can't because we're dealing with COVID. Then what happened that next weekend, we had 3 more people that got diagnosed with COVID. So what I'm saying is not only was I dealing with it personally, but we are grieving it with COVID because we cannot have the normal type of funeral that we're used to. We're at a gravesite ceremony. People that I work with in counseling, what I deal with, my families, my patients that are dealing with their loved ones that have had a COVID and have had died, they didn't have the closure. They missed the closure. They did not see that loved one. They didn't tell that loved one goodbye. They didn't let them know how much they meant to them. There's issues with grief and death right there, death and dying. We do work through the stages of death, but the biggest one at that point, they did not have the closure. And then the funeral is totally different. It's a gravesite. And you know, in our community, we're used to having a funeral. We're used to having people come to visit, bringing food to our house, checking on us, calling us. That's no more now. So we are grieving. Not only are we grieving that, but we're grieving what our community used to be like. Think about our population. Think about our elderly population. And I'm in that population. 50 to 80 years old plus, we are used to being in church. What do I hear a lot of the seniors in my church talk about during this time, during the pandemic? They are lonely. They miss that touch. They miss that fellowship. They miss that hug. They miss hearing the word and listen to the pastor, missing Bible schools, Bible lessons, Sunday school lesson and Bible study and prayer meeting. So we're missing that. And so when we look at this, I already said this, and I left this out because of time, but also we've had an increase in suicide in our community. I already mentioned because of COVID, clinical depression and anxiety has increased, but also let's tie this back into heart disease. Individuals with heart problems are more likely to experience depression. This all ties in, it all relates. It relates to the underlying major risk factors that we already have. How many in this session right now, in this webinar, have a form of heart disease? We already talked about that. And then also, I want us to look at when we get diagnosed with depression, our duration lasts longer. As African Americans, we stay in depression 56.5% longer than any other group. And we look at the social factors, our community, the Black community, we as African American women are at a higher risk factor than our counterparts due to social factors. And what do we mean by the social factors? I'm talking about the structural racism that we're experiencing. I'm talking about the discrimination that we've experienced, long-term discrimination. Because of this structural racism, societal factors more likely can cause us to develop risk factors for cardiovascular disease. I'm talking about the risk factors right there, the stress that we're dealing with, the psychological impact, the social factors. Next slide, please. Thank you, Mrs. Harton. So the next slides this slide deal with, because what we're experiencing is there's barriers to treatment. Because we know as African American women, a lot of times our population would not want to go to a certain doctor because of socioeconomic disparities. There is stigma attached. When I'm talking about the stigma, yes, I'm talking about mental health challenges. I'm talking about the mental health, the behavioral health issues. A lot of times because of that, we won't seek help for depression or anxiety or any other mental health disorder. Not only, and I know this to be true, I had 2 people reach out to me this past week who wanted to get in counseling. They were 2 Black males. You know what they called me and said? After their family members were upset, crying, and wanted them to seek services, they told me that Black men don't seek counseling, and they did not feel that they needed counseling. They felt that they were adjusting just fine. There's a stigma attached. I know when people walk into the room and find out that I'm a Black therapist or a Black counselor, and they happen to be Black themselves, the first thing they say is, I can relate, I can understand. They feel that there's a disconnect, not only with this, but what about provider bias and inequality of care? Those are our concerns. Other concerns at this time that we're dealing with. What about the vaccine? Is it available? Are we being able to get the vaccine? Not only that, what about getting tested? So there are other concerns that we are dealing with that are barriers to treatment that we deal with, not just with mental health challenges, but also with the COVID. Next slide. And I just want to talk about the most important thing. If we have cardiovascular disease, and I do have it, and right now I am still taking my blood pressure every single day, just like Masara said. And ever since I've been diagnosed with COVID, my blood pressure has been elevated. But I'm recommending that we seek care, we seek help. We go to a primary care physician, we go to a psychiatrist or a mental health therapist. And I will not have time to discuss all the techniques that I use in my practice, but in counseling, we do focus on psychotherapy. That is being able to express our feelings, to verbalize the hurt, the struggles that we're dealing with the stressors of life that a lot of times we've been taught to keep in. We've suppressed that. I focus a lot on psychoeducation, like we're doing now, increasing our awareness, increasing our knowledge about cardiovascular disease, about depression or anxiety, or even COVID-19. And there's other techniques that I use, and they are listed, the mindfulness and the cognitive behavior therapy that we do use in treatment. And I come before you today, the next slide, I come to you today talking about what is in your wellness toolbox. What are you using to help you to stay healthy? And what I'm saying about that, because we have to watch our weight. We have to manage our weight. I've been managing my weight now for the last 20 years of my life, over 20 years of my life. I didn't do it initially when I was diagnosed with cardiovascular disease, but these are some of the things I want to focus on. What about your stress? Are you managing your stress level? Look at your stress. There are ways to decrease our stress, decrease our depression, and decrease our anxiety. And I have to tell you, what got me through it when I had COVID, it was the fact that I was praying, I was meditating, I was doing devotion. I started praising God. When I start praising God and I start talking about this too shall pass, this is the past, I'm gonna get through this. This is what helped me maintain my sobriety in isolation, because my husband was in complete isolation. My husband could not get out the bed for 8 straight days. I was taking care of him, taking care of me, taking care of my house, and taking care of a business as a director. So what I'm saying is I had great support. I thank my family for their FaceTime, my grandbabies FaceTiming me every single day, my children FaceTiming me. My mother, I will say to you, she decreased when we got sick. Her health started to deteriorate. I saw my mother get sicker. My mother went through depression because she couldn't see us. So what I'm saying to you, my support came from my family. My support came from my friends. And what I want to say to my sorors, they know who were there. They're the ones that were bringing me food to my house every day, making sure I was okay. That is what helped me keep my sanity as well. And if I do not say anything else, as a person that's lived with cardiovascular disease for 32 years, I had to start following the American Heart Association guidelines. So I'm going to ask you, what are you doing to live healthier? Are you eating healthier? Are you including more fruits and vegetables in your diet, like 6 servings a day? Are you using olive oil? Are you using vegetable oil? Are you using sunflower oil to cook your food with? Are you roasting your food, baking your food? Are you doing those things to help us to live healthier? Are you managing your weight? Are you taking your medication? These are key. And as everyone already knows, the other guideline is, of course, no smoking. Of course, moderation, but be mindful. I quit eating fried food. I made a lifestyle change. And all my specialists have told me if I had not made those changes, I would have had a heart attack or stroke by now. So what I say to you before I wrap up, are you exercising 30 to 60 minutes a day to decrease stress, cardiovascular disease, and COVID? And what I want to say before I wrap up, my heart has truly been heavy today. And my heart has been heavy because last night as I was preparing, another friend of ours that we all know lost her sister yesterday with the battle. And we do not die from COVID. We die from the fact that it attacked so many parts of our body. So I want you to imagine if we take immediate action right now to take and to address the underlying psychological stressors that we are dealing with today and the comorbid conditions, perhaps thousands of our lives could be changed. Perhaps we can spare a future loss of our Black sisters and brothers. Perhaps we can still make a difference if we make a few lifestyle changes, because our lives matter. Your life matter. Black lives matter. Please join us in making a difference and making a lifestyle change, because we have heard the testimonies of many people today that are making those lifestyle changes. If you have any questions, any concerns, feel free to call my office. The information is listed, my phone number, as well as the email address. And we have 9 providers in our practice that can assist and help. Once again, I thank you for affording me this opportunity today to talk about the importance of cardiovascular disease, COVID, and depression. And I am a survivor today, a month later. Thank you.
We'd like to thank Sarah Butler for her information, her wealth of information, and you can tell she's passionate about her job. So if you do have questions, please contact her office. At this time, we're going to move down to the remarks. But before we come to the remarks, I would just like to thank the Aiken Alumni chapter of the Link Incorporated for inviting me to be your moderator for this afternoon. So at this time, we're going to move down to the Sarah Kristen Allen, president of the Aiken Alumni chapter of Delta Sigma Theta Incorporated, and also Sarah Rosemary English, who's president of the Aiken chapter of the Links Incorporated, for the remarks. Thank you.
Good afternoon. On behalf of the Aiken Alumnae chapter of Delta Sigma Theta Sorority Incorporated, I'd like to thank the Aiken Links for allowing us to once again co-sponsor this important health event. Thank you to the participants in their Go Red Heart Health webinar, especially to the women of Delta Sigma Theta. Keisha Mays, thank you for letting us know the importance of organ donation. Tanya Williams, Rosemary English, Teresa Pope, for your coordination with the Aiken Links, and especially for Tanya Williams for emceeing the event. Catherine Toomer, for your valuable insight to the symptoms and diagnosis of heart disease. Sherelle Butler, for your professional insight on the emotional side of heart disease and its effect on the patient and caregiver. Latrice Carter and Kadena Simpkins, for your courage and your bravery to share your personal heart health journey with us. And all the Sorors in attendance and the Sorors who are members of the Aiken Links, thank you. Virginia Regsby, thank you so much for standing in for Desmond Woodruff. If I've left anyone out, please blame it on my head and definitely not my heart. Lastly, thank you to those who took the time out to be with us and listen to this important health message. Hopefully everyone had a takeaway about the heart health journeys that was shared today. We must also remember those that have stories that are not able to share them today. Each of us must take a personal responsibility and take care of ourselves and our loved ones. Again, thank you so much for today. Thank you.
Tanya. Good evening. Good evening, ladies. You look so beautiful and you have provided a wealth of information. I'm Rosemary English. I am both a Delta and a Link, and happy to be both. Thank you for sharing your wealth of information with us today. It is amazing the story that we have heard today. And one of the things that I thought about as I listened seemed to be a year that was phenomenal. The young man who was the heart recipient, Desmond, was diagnosed in 2015. The young lady, Belvia Payne, who is the person that we are honoring today, her memory, died in 2015. Her son now, he was in high school at that time. I talked with his dad and he indicated that he is now a graduate of Morehouse University. He's in his first year of medical school. So we can see that the impact is moving on. And we have been such a powerful, powerful group. And together, we're even more powerful. I am just amazed by the number of people that we have touched today. And I'm especially amazed by your testimonies. I cannot even find the words to say thank you. Thank you just seems so insufficient. But I say to you, continue to do the great work. Continue to be that beacon of light, because we are indeed both our brothers as well as our sister's keeper. Thanks again. God bless each of you. Especially, I want to say to Virginia, please say to Desmond, we're sorry we missed him, but his story was so touching and so moving. Thank you.
This concludes the Go Red Heart Health Awareness Program. Thank you all for joining us.
Thank you.